السلام عليكم ورحمة الله، ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا مراجعة أسئلة اختبارات البرومترك review or Prometric test question. This is last lecture in maternity, and then after we begin pediatric inshallah next lecture. Today inshallah we're going to discuss 5 questions from question number 109 up to question number 130. معكم محمد الثمانية. نبدأ مباشرة. A postpartum client is diagnosed with cystitis. The nurse should plan for which priority action in the care of the client. The options are number A, providing six bath, and number B, encourage fluid intake, number C, placing eyes on the perineum, number D, monitoring hemoglobin and hematocrit levels. وقف الفيديو هنا واختار الخيار بشوف ازاي. The correct option is option number B. ليه اخترنا خيار رقم B؟ نشوف rational. Cystitis is an infection of the bladder. The client should consume 3000 ml of fluid per day if not contraindicated. So the correct option is option number B, which is encourage fluid intake. Regarding to the option number A and C, bath and eyes would be appropriate intervention for perineal discomfort, but not for cystitis. And regarding to the monitoring hemoglobin and hematocrit level, option number D, hemoglobin and hematocrit levels will be monitored with hemorrhage, but not with cystitis. So the correct option is option number B, which is encourage fluid intake. Question number 110. The nurse is monitoring a postpartum client who received epidural anesthesia for delivery for the presence of a bulbar hematoma. Which assessment finding will best indicate the presence of a hematoma? The options are number A, change in vital sign, number B, sign of heavy bruising, number C, complaint of intense pain, number D, complaints of a tearing sensation. وقف الفيديو هنا واختار الخيار وشوف ازاي. The correct option is option number A, which is change in vital signs. ليه اخترنا الخيار رقم A؟ نشوف rational. Because the client has had epidural anesthesia and is anesthetized, she cannot feel pain, pressure, or tearing sensation. So eliminate option number C and D. Changing in vital signs indicate hypovolemia in anesthetized postpartum client with valvular hematoma. So the correct option is option number A, which is changes in vital signs. Regarding to the option number B, which is signs of heavy bruising, may be seen, but vital sign change indicate hematoma caused by blood collection in the perineal tissue. So the correct option is option number A. Question number 111. The nurse is creating a plan of care for a postpartum client with a small bulbar hematoma. The nurse should include which specific action during the first 12 hours after delivery. The options are number A, encourage ambulation hourly, number B, assess vital sign every 4 hours, number C, measure fundal height every 4 hours, number D, prepare an ice pack for application to the area. وقف الفيديو هنا واختار الخيار اللي تشوف ازاي. The correct option is option number D, which is prepare an ice pack for application to the area. ليه اخترنا الخيار رقم D؟ نشوف rational. A vulvar hematoma is a localized collection of blood in the soft tissue of the vagina or vulva after delivery. Application of ice reduces swelling caused by hematoma formation in the vulvar area. So the correct option is option number D, which is prepare an ice pack for application to the area. Regarding to the option number A and B and C are not interventions that are specific to the plan of care for a client with a small vulvar hematoma. So the correct option is option number D. Question number 112. On assessment of a postpartum client, The nurse notes that the uterus feels soft and boogie. The nurse should take which initial actions? The options are number A, document the findings, number B, elevate the client's legs, number C, massage the fundus until it is firm, number D, push on the uterus to assist in expressing clots. وقف الفيديو هنا اختار الخيار اللي تشوفه صحيح. The correct option is option number C, which is massage the fundus until it is firm. ليه اخترنا الخيار رقم C؟ نشوف rational. If the uterus is not contracted firmly, it is soft and boogie, the initial intervention is to massage the fundus. So the correct option is option number C, which is massage the fundus until it is firm. Elevating the client legs will not assist in managing uterus atony. And regarding to the option number A, document the finding. Documenting the finding is an appropriate action, but is not the initial action. Regarding to the option number D, push on the uterus to assist in expressing clot, pushing on an uncontracted uterus can invert the uterus and cause massive hemorrhage. So the correct option is option number C, which is massage the fundus until it is firm. Question number 113. The nurse is preparing a list of self-care instructions for a postpartum client who was diagnosed with mastitis. Which instruction should be included in the list? Select all that apply. This is strategic word, means that you have to select any option that apply to the question. The options are number A, wear a supportive para. Number B, rest during the acute phase. Number C, maintain a fluid intake of at least 3,000 ml per day. Number D, continue to breastfeed if the breasts are not too sore. Number E, take the prescribed antibiotics until the soreness subsides. Number F, avoid decompressions of the breast by breastfeeding or breast pump. وقف الفيديو هنا واختار الخيارات اللي بتشوفه صحيح. لما نلقى select all that apply معناها بإمكاننا نختار أكثر من خيار. The correct option is options number A, B, C and D. ليه اخترنا خيار A, B, C and D؟ نشوف rational. Mastitis is an inflammation of the breast as a result of infection. Client instructions include resting during the acute phase, maintaining a fluid intake of at least 3,000 ml per day if not contraindicated, use of moist heat or ice baths and wearing a supportive bra, continued decompressions of the breast by breast pump or breastfeeding if not too sore, to empty the breast and prevent the formation of an abscess. So the correct option is option number A, B, C and D. Regarding to the remaining option, the option number E is incorrect because antibiotics are not stopped when the soreness subsides. And regarding to the option number F also is incorrect because the client should continue decompression of the breast by breastfeeding or breast pump. Why? Because it's important to empty the breast and prevent the formation of an abscess. لغاية هنا نشكركم إن شاء الله ونتقابل المحاضرة الجاية. Don't forget to support us by comment, like or subscribe. مع السلامة.